One simple step can make a difficult endometriosis surgery or severe pelvic adhesion much safer, and that step is organ suspension. Let me explain. What do we mean by organ suspension? Organ suspension is a safe and effective laparoscopic technique used in gynecological surgery. It is mainly used in severe endometriosis cases and complex pelvic surgery. The idea is simple. We temporarily lift a pelvic organ like the ovary or uterus and fix it away from the surgical field. Organ suspension helps us see better. If the uterus is in its normal position, the punch of the glass is hidden. But when we move the uterus forward, everything becomes clear. Another important benefit is organ suspension helps minimize complications. For example, if the bowel comes into the surgical field while we are dissecting or cutting, it can easily be injured. But by suspending the organs, we keep the bowel away and make the surgery safer. It also allows more effective use of instruments. By keeping the organs out of the way, the surgeon can use instruments freely and precisely. This also helps the assistant focus on the surgical steps instead of just holding or retracting tissues. And because of all these advantages, the surgery becomes faster and more efficient. What are the techniques? First, gas insufflation. We insufflate the abdomen with gas to create space. This gives us room to see clearly and operate safely. Second, we use the trundling back position, which moves the bowel up and clears the pelvic field. The last, the last suspension technique is temporary repositioning of the ovary, uterus, or bowel to the lateral pelvic side wall using a suture or T-lift device. As you can see, organ suspension is a small step that makes a big difference in laparoscopic surgery. If you found this helpful, don't forget to like, subscribe, and share. Thank you for watching.